And here is the normal spine. I have it in the same direction. This is the anterior, posterior, base of the skull. And remember we said there were 7 vertebral bodies. 1, 2, 3, 4, 5, 6, 7. In between each of them are discs, as far as between C3 down to C7. We see the disc. And we see as we look from one vertebral body over to the next, we see that it makes a hole, and that hole is called the infravertebral foramen, where the spinal nerve root exits. Anterior to that, we see this artery, which is called the vertebral artery, and there's one on both sides, right and left, as they come up anteriorly to the cervical nerve root. And the other thing that I need to point out is this particular area back here. This is called the facet joint. This is a gliding, sliding joint, and this is an area of interest because many times it can be a problem. Now, again with the cervical spine, remember we said that most rotation came from the C1 atlas rotating on C2, the axis that has that odontoid, so it rotates like this. Okay, and we said most flexion extension came from the relationship of the base of the skull condyle on top of the atlas, like this. Okay. However, most motion from the rest of the cervical spine, from C3 down to C7, occurs between 4 and 5. Where is that? 1, 2, 3, 4, 5. So between 4 and 5, because this is very important, because as we look at the posture of the cervical spine, we notice that the cervical spine commonly has a lordotic curve. We call this part the concave. In the concave area, the greatest degree of concavity is between 4 and 5. Why is that important? Because that's where the greatest stress is going to be placed on this area, between 4 and 5. You have this heavy head, big brain, pressing down. We notice that it has a lordosis, and the most of the pressure is going to come at C4, C5. Also some by C5 and 6, but primarily C4 and C5. The other thing I need to mention is that between C4 and C5 is the C5 nerve root. Okay? Remember that there's only 7 bones in the cervical spine, but there are 8 nerve roots. That's very important. So, not like we see in the lumbar spine where you have L4, then below that would be L4. However, here with the cervical spine, if you have C4, the bone C4, below that will be C5, the nerve root. So, this is normal. Let's look at an abnormal cervical spine. Wow, that's abnormal, all right. And let me show you what I'm talking about. This view is a lateral projection. And just let me pop this up for a second. See, lateral projection. Anterior, posteriorly. And here we can see, it might be hard to see, so we'll start here. This is actually C2 here. And sometimes when we can't tell where C1 and C2 is, we look back here to where the spinous process is. That's this part of the bone. And we look back here, and here, oh, okay, we see that there's 2 separate ones. So this has to be C1, and this is C2, and then C3, C4, C5, C6, and C7. Sometimes hard to see 7 because the shoulder, soft tissues of the shoulder are blocking it. Many times we tell our patients, or we have the patients holding some weights so we can clearly see C7. But this will give us sufficient information. Now, the patient's head is already slightly extended, so it emphasizes the lordotic position. But let's see, there's some other findings here, and I don't want to go into great detail, but on an X-ray, we can't see nerves, we can't see disc, we can't see herniations of disc, but we can see bony tissue, and we can see some soft tissues very clearly. And we can see on this X-ray the different bones. Here's C3, here's C4. And between these 2 bones, C4, C5, is a space. And this is called the disc space. That's where the disc would be, this substance here. But on X-rays, because there's no calcium in the disc, X-rays go right through it, and so we only see a space. So we can say that there's narrowing of the disc space, or it's normal. In this example, there's clear narrowing of the disc space. The other thing that we can see on this X-ray is that there are these little pointing things, and these are what we call spurs. And it's very common to see spurs like this forming anteriorly in the cervical spine. In the lumbar spine, we commonly see spurs forming posteriorly because the pressures are different. Here, we can see that there's more pressure on the disc anteriorly, causing pressure to form these spurs. In the lumbar spine, it's more up and down. The weight is distributed over the disc better.